Hello everyone, welcome to my YouTube channel. This video is about 7 short case scenarios of important cases of chronic diarrhea in children. Case number 1. A 2-year-old child presents with passage of loose stool containing undigested food particles 5 times per day for a duration of 2 months. The symptoms occur during waking hours and become less frequent in the evening. The child is well and has a good appetite and normal growth. Now the diagnosis and special points in favor. This case is toddler diarrhea. It is a chronic diarrhea commonly occurring in children aged 6 months to 3 years. It involves the passage of stools containing undigested food particles about 3 to 10 times per day. Now case scenario number 2. An adolescent male child presents with a 7-month history of passing bloody mucoid stools associated with fever, tenesmus, weight loss, arthralgia, anorexia, and abdominal pain. The last is exacerbated by defecation. And the diagnosis is inflammatory bowel disease. It is more common in older children and adolescents. Crohn's disease is associated with extraintestinal manifestation, for example, arthralgia and oral or perianal lesions. Growth failure may occur with or prior to other symptoms. Now, case number 3. A 1-year-old child presents with a 2-month history of passing loose, mushy, bulky, and smelly stools associated with lethargy, pallor, abdominal distension, and failure to thrive. Now the diagnosis and special points in favor are celiac disease, because symptoms of celiac disease usually appear between 8 and 24 months of age after the introduction of gluten in diet. Case number 4. A male child presents with passage of 3 to 10 stools per day in daytime, not at night. Stooling often occurs after each meal and is associated with a feeling of incomplete evacuation. The child growth is normal. And the diagnosis is irritable bowel syndrome. In this, the first stool in the morning is usually partially formed and become more frequent during the daytime. A feeling of incomplete evacuation is also characteristic. Now, the diarrhea may be alternated with constipation in irritable bowel syndrome. Number 5. A 9-month-old child presents with a 3-month history of frequent bowel motion associated with vomiting, discomfort on feeding, and squirming. The mother noticed that the diarrhea stops when feeding is discontinued. There is a history of acute gastroenteritis preceding the appearance of the symptoms. Now the diagnosis is lactose intolerance. This commonly occurs after acute infection. Diarrhea stops when feeding is discontinued or lactose is restricted. Watery and acidic stools may lead to severe perianal excoriation. Case number 6. A 2-month-old infant presents with a 1-month history of blood-tinged mucoid diarrhea, starting gradually and associated with vomiting, irritability, poor feeding, and skin rashes. There is a family history of atopy. The diagnosis is cow's milk protein intolerance. In this, the symptoms start before the age of 3 months. Diarrhea is chronic and watery or blood-tinged mucoid. Now case number 7. A 3-month-old male infant presents with a passage of large bulky stools with a foul smell for 1 month duration. This is associated with failure to thrive. The child has a history of a delayed passage of meconium for more than 24 hours in the neonatal period and recurrent chest infection over the past 2 months. And the diagnosis is cystic fibrosis. Newborns may present with meconium ileus. Children may have failure to thrive coupled with voracious appetite, rectal prolapse, and chest infections. There may also be passage of large bulky stools with a foul smell secondary to diarrhea. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health related videos.